once again, Diamond Works Med Spa. Welcome, my name is Clarke, Cosmetic PA, and we have
Laura Moore, Cosmetic PA.
Okay, and we have a very exciting segment titled Diamond
Dissection.
All right, so what is Diamond Dissection? We're picking apart features and faces and putting them back together after they're rejuvenated. We're going to talk about how to get from point A to point B. Now, most of these images are online, public domain. They don't necessarily have to be our patients. They're just really everyday patients, normal people. Now and then we may toss in a celebrity, but let's go. So we are going to take a look at our first feature here. Again, this is an online image that we came across. Actually, Laura, you came across this image and you presented it to me to kind of discuss. So tell me about the before first based upon your history with patients and faces.
So what I liked about this example here is that I think there's subtle changes, but it does a lot for her face. She has a lot of static lines above her lips, which is what I first noticed. Yeah, so a lot of static lines, and then you can see in the after photo that those lines are still present, but they're highly reduced.
Right, so it's a very natural looking image. You know, what I like the fact that you said static lines. What are static lines? Static lines are lines that are permanent lines that does not go anywhere unless you treat them. And what we can do for static lines, we can use fillers to kind of blend and soften those lines. One of the fillers that really work in this region is called Restylane Silk, which actually goes between each of the lines and kind of lift the dermis up. So what else do we see here? I'm looking at her cheeks and tear trough region. This is the tear trough. Again,
more static lines here. This is an area that with the crow's feet and then as well as the smile lines, this builds up over time just based on the way the muscles move in that area. So it's a common concern.
So everyone kind of really thinks that, you know, most people think that these lines occur from just smiling and laughing. I will tell you the number one reason, or maybe not number one, but high up in that list for these static lines is going to be sleeping on the face. So what do we always say?
Don't sleep on the face.
Don't sleep on the face. Don't sleep on the face. Sleeping on the face creates a lot of crevices in the skin, and we don't want crevices there. Okay, so we can touch botulinum toxin to kind of raise and open up the eyes a little bit, but when the lines are static, sometimes it requires a filler. What is a filler? What does a filler do?
So the filler can, like you said, elevate the dermis so that those lines aren't as severe.
Absolutely. So the reason why we're getting fall and depression and shadows in the cheeks on the before is also we're losing some of the fat. We're losing some of the volume in the cheeks. So we have superficial fat and deep dermal fat, and that deep fat and the superficial fat works together. However, for example, the superficial fat around this region called the SOOF, that fat sometimes just gets a little smaller and softer. And as it gets softer, it wants to roll forward. So we can use fillers to kind of enhance and push that. Now, this after image isn't the very best after image that she can have, but it's a very natural image. And likely this after image is based upon how many syringes of fillers were done. I will tell you that most individuals require between 6 and 10 syringes of filler, you know, just to get started, and then maybe a 2 syringe or 3 syringe a year as a maintenance. What are you coming across in terms of longevity with fillers?
I think that the filler was really important for her face in particular because of those deep static lines. I think that this was a combination of both Botox and filler, but it made a huge difference in a subtle way. And this is a common concern. Everyone ages
slightly different.
But the gravity is always going to pull everything down. So this is definitely a common area.
Let's go to the next image. All right, is this a celebrity? I don't have a clue.
No, this was just a Google image.
And what was done here, before we talk about the treatment, which I don't know which treatment was done, but what are some of the differences you see between these two images?
In this example in particular, I go right to her jawline. She has like
this jowl. Inferior jowl pouch. Okay.
And then it's definitely reduced on the after photo. So this, I believe, threads were used to pull and accentuate her jawline.
Yes. Oh, so threads were used. So I would definitely say yes. So if threads were used, and as you said, threads are used, what threads do, and this is why I love threads. Threads have to be done the right way.
Right.
If threads are done the common way, you're not going to get great results, and the results are not going to last. You know, the threads have a specific way of working, and the injector or the person using the threads have to have a keen knowledge of the facial anatomy. However, when threads are done well, you can literally remove this jowl and actually have a very straight jawline. So it looks as though she may have also had a little filler within the lips because they look natural.
Right.
And she may also have had some filler in the cheeks as well. Maybe. Again, this is not our patient, so we don't absolutely know.
I also noticed here that the nasolabial folds.
So this is the nasolabial fold.
Right, and that's also improved with the threads, but maybe some filler in that area as well.
So threads can pull multiple structures at one time.
Right.
Fat, muscle, ligaments, mass layer, which is the muscular layer surrounding the face. Let's jump to the third image. Oh, so this is a very, very natural image of an individual. Again, static lines, which are lines that remain whether you're smiling or raising your eyebrows.
Right.
So what's more significant in your eyes here, Laura?
I'm immediately drawn to her forehead. The lines in her forehead are significantly reduced after, I'm assuming, Botox and maybe some filler.
Okay, very good. And again, we don't know these images. They're not our, this is not our patient. So, but credit to whomever did this result. They did a lovely job. What you have is smoothness of the forehead without too much change in the eyebrows. So most important thing is that having these eyebrows near symmetrical, which was accomplished here. On this side, the eyebrows are not really symmetrical.
No, this one's definitely higher.
Absolutely. So I would say here that besides the forehead being done, her glabella zone was also done, which is in this region. And as you can see, this eyebrow is lower in the medial section, but this one is more natural. So definitely this procerus muscle, corrugator supercilii muscles, corrugator heads, these were done with botulinum toxin also, which is going to give you a nice elevation in the center region, and it actually gives this harmony between the forehead and between the eyebrows.
Right, and there's definitely less shadowing under her eyes.
It's less shadow. Now, you had an interesting question a week ago about shadowing under the eye.
Right, I noticed that when you get the Botox in your forehead, it can lift your face to the point where you don't have that darkness, those dark circles that everyone complains about. I think it can reduce that by pulling up your forehead as well as your eyebrows.
And we use the term Botox. Everyone knows this as Botox, you know, but there's also Dysport, there's Jeuveau, and there's Xeomin. So there are 4 botulinum toxins available in the US, and slight differences. I tend to be on the side of the Dysport most of the time for specific reasons. But yes, so botulinum toxin or Botox or Dysport is going to give you this harmony in the face. It looks as though she may have had some fillers as well.
I agree.
Take a look at the cheeks. Look at this malar groove, the flattening that occurs. You know, once you hit 24, 25, nothing gets better unless you do something about it. Sleeping on the face is also going to crush the fat deposits within the cheeks. Don't sleep on the face. So I believe that some filler was done in the cheeks, which gives her a nice rounded cheek. Here she's smiling, she has a smirk. She doesn't really have a smirk here, but you can still tell that these cheeks may have somehow been accentuated or rejuvenated.
Yeah, she definitely has a lot of volume loss here, and it's reduced on this side. She looks way more refreshed, younger.
Stay tuned for more on Diamond Works Med Spa podcast and Diamond Dissection if you want to see what subtle changes or extravagant changes can occur within the face. Subscribe if there's a subscribe button. Stay tuned, stay focused on your overall results. Don't sleep on the face, don't sleep on the face, don't sleep on the face. Thank you all, Laura. Great to have you here with us.
Thank you.
Thank you all.
Thanks, guys.